Welcome back, avid learners. It's Raffaele here, bringing you another exciting episode on UNYP Education, where we demystify the intricate world of statistical methods. Today, we are illuminating the complexities of two-way between-subjects ANOVA, a robust statistical technique vital in psychological research. So, we discussed a lot in the previous videos on what is an ANOVA. It is a statistical method allowing us to investigate the differences in means among different groups, enabling a profound understanding of relationships within our data. But let us discuss two-way between-subjects ANOVA. You've heard one-way between-subjects ANOVA, you've heard one-way within-subjects ANOVA, but you have never heard of two-ways ANOVA. So what is it? What is the difference? So two-way between-subjects ANOVA, it is a distinct test from one-way ANOVA due to the involvement of two independent variables, and it contrasts with within subjects ANOVA because, well, there is no within factor there, so that's pretty easy. Each subject is only subjected to one level of each factor. Easy enough. In ANOVA, ways represent the number of independent variables. So when we have one-way ANOVA, what we mean is that we have one independent variable. When we say two-way ANOVA, we have two independent variables. If we have like 100-way ANOVA, we have 100 independent variables, but hopefully that's not going to be your case, because that would be hell to analyze, especially the Post-Hoc tables, can't even imagine. But let us suppose that that's the case. So yes, ways means independent variables in ANOVA pretty much, whereas levels is something a tad different. Level refers to the different categories within an independent variable. So this dataset here, it's a two-way ANOVA because we have two independent variables, psychopathology and therapeutic stance. Psychopathology has two levels, depression and anxiety, and therapy has three levels because it has psychodynamic, CBT, and schema therapy. Now, we know about the assumptions, of course, yeah. Again, normality. Now, I will not speak about normality because I discussed about normality in virtually all previous videos, so at this point, you know, Shapiro and Wilk should be your best friends, so let's leave it be. Homoscedasticity, also we discussed several times. It was tested with the Levin's test of homogeneity of variances, and it's a critical assumption, but, you know, for the purpose of these videos, and since two-way ANOVA is a robust test, in case it is violated, it doesn't have to halt our analysis, but we just need to report it, and maybe I would recommend it just take a more conservative significance level. So maybe consider a significant p rather than, like, you know, less than 0.05, maybe less than 0.01, let's say. When it comes to effect sizes, again, when it comes to ANOVA, we always have eta squared, which helps us quantify the proportion of variance in the dependent variable attributed to an independent variable. Again, it is the usual as every other video. Please check them out if you haven't done so far. It is crucial for understanding the practical significance of our finding. If we have a high effect size, it means that our independent variable is affecting our dependent variable very much. So, after that, we have Post-Hoc. We also have Post-Hoc in two-way ANOVA. It's even, the tables are even way bigger than in one way. Tukey is generally preferred because it has control over type 1 error rate across multiple comparisons, but as I mentioned in the video on one-way within subjects ANOVA, Bonferroni is kind of a panacea when it comes to post-hoc tests, in as much as it can be used pretty much everywhere. So Bonferroni is also suitable, especially when we wish to be more conservative and control the family-wise error rate in our dataset. Now, we arrive to some concept which is very, very important in two-way ANOVA. We should understand the difference between main effects and interaction effects. This is pivotal to understanding two-way ANOVAs and well, henceforth other kind of ANOVAs as well. Not going to create spoilers over there. So main effects reflect the impact of each independent variable on the dependent variable while ignoring the other independent variable. I know this sounds like a tongue twister, but it's easier than what you can think. So in our dataset we have here psychopathology. The main effect of psychopathology in this dataset would be the effect that psychopathology has on likelihood of staying in therapy, excluding the type of therapy, and vice versa. The main effect of therapy would be the main effect that therapy has on the likelihood of staying in therapy regardless of psychopathology. So, for instance, in this case we have 3 levels, if you remember, and we have the likelihood of staying in therapy, which is a normal continuous variable. So the main effect would be, is there a significant difference between the 3 therapeutic approaches and the likelihood of staying in therapy? Yes or no? That is the main effect. But we exclude the psychopathological element in this. And vice versa, if we're looking for the main effect of psychopathology on likelihood of staying in therapy, we exclude the therapeutic stance. Now, I understand it can be a lot to digest, but trust me, you will make a callus and it will be pretty immediate after all. Now, we have instead interaction effects. They explore instead how one independent variable affects the dependent variable differently at different levels of the other independent variable. Even this is probably even harder to digest. Now, if we look at the therapy here, right, we have 3 levels, and psychopathology we have 2 levels. So we want to see, for instance, in the interaction effect, how the difference between depression and anxiety on likelihood of staying in therapy differs at a different level. So how does it differ in psychodynamic therapy? How does it differ in CBT? How does it differ in schema therapy? And that is our interaction effect. So you're just taking, let's say, the main effect, allow me to say it, but you're nesting the main effect within the other independent variable in their level. So you're seeing in the psychodynamic level what is the difference between depression and anxiety when it comes to staying in therapy. And in a nutshell, hopefully digestible enough, this is what is an interaction effect. Now, let us get started with this example. We are assessing whether the likelihood of staying in therapy differs with varying psychotherapeutic approaches and different conditions, depression or anxiety. A main effect might reveal a difference in staying in therapy between patients with depression and those with anxiety, irrespective of the therapy type. Interaction effects would highlight if, say, patients with depression are more likely to stay in CBT than those with anxiety. So, stay with me as I guide you through this real-world dataset. So, we are in this dataset, and once again, as usual, we will go to ANOVA. As you can see, we don't have a two-way ANOVA, so we will just go to the normal ANOVA over here. Now, we have, as usual, dependent variable, which Jamovi tells you is the ruler one, meaning the continuous one, so that's pretty easy. And we have both fixed factors or independent variables, so psychopathology and therapy. Now, we have eta square, as usual, assumption checks, just homogeneity. We don't want normality, like you can do it, but let's keep it for this time. Then we have post-hoc tests. You don't have only the post-hoc of therapy, you don't have only psychopathology, but you also have the combination of them. I would choose Tukey for the purpose of these videos, in as much as I imagine that majority of instructors would prefer you to use Tukey, but remember that also Bonferroni is an option. And for estimated marginal means, we have term 1, which is just therapy, term 2, which would be psychopathology, and term 3, which would be psychopathology and therapy together. And we want tables as usual, because they're easier to read, let's be honest. Now, let us delve into our results. Now, first of all, homogeneity. I will give you a few seconds. Is it violated or not? it is not violated, in as much as P is above 0.25. Now let's delve into our main table, the ANOVA table. So, therapy alone means it's the main effect of therapy on likelihood of staying in therapy, and it is significant, with an eta square of 0.492, which is pretty high, let's say medium high. Psychopathology as a main effect also is significant, meaning also there is a difference between anxiety and depression and the likelihood of staying in therapy, a bit less when it comes to the effect size, and also the interaction effect, meaning that the two interact significantly. But the Post-Hoc table will give us a better glimpse into this interaction. So, the main effect, you have the Post-Hoc is just for the main effect of therapy. So you have psychodynamic CBT, it is not significant. Okay, so we know that there is a significant difference overall in the main effect, but there is not a significant difference between psychodynamic and CBT when it comes to staying in therapy. There is a significant difference between psychodynamic and schema, as well as between CBT and schema, because we have 2K here, which is below 0.1, but if it would be below 0.5 would be also fine. Now, main effect of psychopathology, virtually it's a between subjects t-test, or t-test for unrated scores, depression, anxiety, significant, of course, because there's only two terms. This means that practically, for post-hoc tests, we need at least 3 levels, so we can remove it, you can keep it here, but it's basically just the same as this one, more or less, just like a t-test. So let's remove it. And now we will go into this table over here, the table with the post-hoc in the interaction effect. So we have the main effect of therapy here, and we want to see how therapy differs at different levels of psychopathology. So psychodynamic therapy and depression, and the difference between psychodynamic and anxiety, it is significant because it is below 0.05. It is not for CBT, not for CBT and anxiety, but it is between psychodynamic depression and schema and depression. So, as you can see, this table, it is pretty big, pretty confusionary. It can create a lot of stress and panic. Now, this table is mostly used in the real world, let's say not in universities, unless you have specific hypotheses. If the hypothesis of our researchers would be that there would be a significant difference only between people that are doing CBT while depressed and people that are doing schema while depressed, then you will need this post-hoc comparison with the interaction effect, where you will have CBT depression and schema depression, and it's significant. So in that case, it will be confirmed. So don't worry about it. For the purpose of your classes, most of the time, your instructor is not going to ask you too much about the interaction effect. Regardless, know that what you simply have to do is look here, be patient. Now in this we have 2 levels on one IV and 3 levels on the other IV. However, sometimes we can have 4 IVs, each of them having 3-4 levels. So the table would be humongous and absolutely unsustainable. So don't worry about it. It's unlikely it will happen unless you're going maybe into more econometrics or hardcore sociology or socioeconomics. But for psychology, most of the time, let's say, you will not encounter this, or at least not in your university career, unless you want to go to academia. Estimated marginal means, I'm pretty sure you know how to read them, and we have here just the difference of the interaction effect of the marginal means. So we have psychodynamic depression, we have a mean of staying in therapy of 8.47, which is pretty low, but the lowest is for anxiety, which makes sense. Just imagine if you are anxious and you have Freud as your therapist. It would be pretty tough, let's be honest. But yeah, so as I showed you, I think the two-way ANOVA, just the theoretical part is a bit more complex, because you have interaction effect, main effects. That's something that you have to think about, and it can be scary. But when it comes to the practice of it, it is as simple as a one-way between subjects ANOVA. You just have the extra step of looking at these interactions or inserting here 2 at the same time. But it's pretty much the same. So when it comes to being complicated. So don't fret every time you hear two ways ANOVA. It is fine. You got it, and I'm sure you're gonna ace any test that will display this two-way ANOVA. And as we wrap up this exploration into two-way between subjects ANOVA, I hope you've gained a deeper understanding and appreciation for this powerful analytical tool. Remember, the world of statistics is not just about crunching numbers, it's about uncovering the hidden layers and subtle nuances within our data, enabling us to make more informed, impactful conclusions in psychological research. With this knowledge, we can optimize therapeutic approaches, tailoring them to unique needs and responses of individuals with varying psychological conditions. Thank you for joining me in this intellectual journey. Don't forget to hit the like button and subscribe to UNYP Education for more enriching content. I'm Raffaele, and I'm looking forward to our next exploration into the enlightening world of statistics and psychology. Keep learning, stay curious, and continue to explore the boundless dimensions of human understanding.